Some men begin to notice that their penis appears smaller over time. This change, in addition to impacting self-esteem, can also raise concerns about health. What many do not know is that there are specific conditions that can cause this shortening, some of which can be treated and reversed. While others require ongoing care to minimize their effects in this video, I, Claudia Rossi, urologist, will explain the 4 main conditions that make the penis smaller and show how to identify early signs and the available options to address each situation. This information can make all the difference for those who want to maintain intimate health and avoid more serious problems in the future. If you are not yet subscribed to the channel, take this opportunity to subscribe and follow more content about health and S3 sexual education. If you like this video, click the like button. This helps more people access this information. Comment 1 if you approve of the topic or 0 if you have suggestions for improvement. Your overview participation helps us bring increasingly relevant content as years go by. Many men start to notice changes in their bodies, and one of them might be the perception that their penis looks smaller. This kind of observation often causes concern, but it is more common than it seems. There are several conditions that can lead to this reduction, and they affect a significant portion of the male population. In many cases, these changes are associated with natural bodily processes or even specific health problems that can be avoided or treated. Identifying the causes behind this. Shortening is a crucial step in dealing with the issue more calmly in some situations. This reduction is temporary, but it may also be related to more permanent changes. Recognizing the signs and understanding what is happening helps in making more conscious decisions about one's own body, with the goal of helping you live a healthier and more fulfilling S3 life. I developed the ebook Rediscovering Intimacy: Healthy S-Sexuality After 60. This practical guide provides tips for strengthening relationships, overcoming physical and emotional challenges, and reigniting passion and connection in couples. To get your copy, just click the link in the first pinned comment. Don't miss this chance to renew your love life. The first cause of this change is known as Peyronie's disease. This condition, although rarely discussed, can significantly impact men's lives, affecting both physical and emotional aspects. To better understand it, think of the penis as a balloon that needs to expand evenly to function penis disease properly. Now imagine that a hardened spot appears in part of this balloon. Preventing it from expanding, this blockage is exactly what happens when plays of rigid tissue form around the structure responsible for erection. Researchers believe that Peyronie's disease is often linked to minor traumas, such as those that may occur during sexual activity, or even due to improper handling, these traumas seemingly harmless. At first trigger an inflammatory process over time, this inflammation creates hardened areas, called plaques in the tuna alluga, the layer that surrounds the corpora cavernosa, the regions that fill with blood and allow for erection. These plaques can cause visible changes, such as penile curvature retraction, and in more severe cases, even pain during erection. This curvature can range from mild to severe, potentially affecting S3 sexual performance, and consequently self-esteem. The greater the deformity, the more noticeable the perceived shortening tends to be. Fortunately, there are treatments available for more advanced cases. Surgical procedures can straighten the penis, and in many cases, preserve its original length. In less severe cases, medications and local therapies can reduce symptoms and prevent the problem from progressing. Seeking medical help at the first signs is essential to preserving quality of life. Life, the weight gain. Second cause is directly related to weight gain, especially in the area below the abdomen. With weight gain, it is common for the body to store fat in strategic areas, one of which is the pubic cushion, the soft layer located just above the genital organ. This fat accumulation creates the impression that the penis has become smaller, but in reality, it has not lost any length. Imagine someone putting a ring on a swollen finger. The ring seems smaller, but the problem lies in the swelling around it. In the case of the penis, the accumulated fat acts, similarly covering part of the base and making it appear shorter or even retracted. This situation is more common in overweight or obese men, as the excess fat pushes the skin forward, hiding part of the visible length. The positive side is that this condition is not permanent. By losing weight and reducing localized fat, the penis tends to return to its original appearance, regaining the length that was hidden. This happens because the pubit cushion shrinks, exposing the base of the penis and restoring visual proportions. For those who are bothered by this situation, maintaining a healthy diet and exercise routine can make a big difference. In addition to improving body aesthetics, this change promotes overall health, including blood circulation, which also supports the Q-view quality of erections. This is another reason to avoid fat accumulation and keep the body active. The third cause is directly aging linked to aging, a natural process that affects the entire body, and the penis is no exception. Over the years, the tissues that provide structure and elasticity to the penis begin to lose their properties. These fibers, mainly made of collagen, become less flexible, which impacts the ability to expand during an erection. Think of the elastic band of a pair of pants that loses its firmness over time. It still works, but it no longer stretches. As it once did, something similar happens with the tissues of the penis, which become stiffer and less pliable. This process creates the impression of a size reduction, even though the structure itself remains the same. In addition, aging brings another significant change: a drop in testosterone levels. This hormone essential for erectile health gradually decreases, which can affect the firmness of erections and even blood circulation in the area, with reduced blood flow and less elastic tissues. It is common for the penis to appear smaller and less voluminous. Although these changes are part of the aging process, there are ways to minimize their effects. Physical exercise, a balanced diet and healthy habits help preserve circulation and tissue elasticity, maintaining erectile health. Taking care of the body throughout life is the best strategy to age without noticeable changes. The fourth cause involves certain medical treatments, especially those aimed at combating more serious illnesses, such as prostate cancer, while necessary to preserve health. This type of treatment can leave some visible physical changes, including the impression of a smaller penis. To better understand this, imagine the prostate as a central link in a chain during surgery. To remove this gland, a procedure called radical prostatectomy. It is necessary to reconnect the remaining parts to restore urinary flow. However, this adjustment may slightly pull the penis inward, creating the impression of shortening. In addition to surgery, treatments like radiotherapy can also influence this aspect when the pelvic area is exposed to R-ration. The tissues around the penis can lose elasticity and become stiffer. This structural change can affect both flexibility and perceived size, especially over time. Although these changes may be challenging, it is important to remember that preserving health always comes first. Post-treatment. Rehabilitation techniques can help minimize these effects, such as exercises to improve blood circulation and specific devices to maintain erect function. Therefore, even if medical treatment is a relevant factor, it does not have to be seen as a definitive sentence. With proper care, it is possible to reduce impacts and maintain quality of life. In all aspects, some of the causes mentioned so far can be controlled or even prevented with the right care. However, there are situations where these changes in the body are inevitable, especially when dealing with more serious conditions or natural processes, like aging when the body undergoes more intense transformations, such as delicate surgeries or significant abdominal fat accumulation. It is common for the visual impact to be greater. For example, a man facing severe obesity may notice that his penis appears smaller, simply because it is partially covered by surrounding fat deposits. Similarly, someone who has undergone prostate cancer treatment or experienced a loss of tissue elasticity due to age may also notice this difference. The good news is that in many cases, there are solutions to help mitigate these effects, whether through lifestyle changes such as weight loss and exercise, or with medical treatments and corrective surgeries. Effective alternatives are available. On the other hand, in some situations, the most important thing is to understand that this perception of reduction does not necessarily affect functionality or quality of life. Being well informed about the subject is the first step to addressing it with greater ease and confidence. After all, knowing what is happening with your own body allows you to make better decisions and face these conclusion changes without excessive worries. Changes in the body, especially those affecting intimate health, can be challenging. But understanding the causes and seeking solutions is the first step to managing these issues. We have seen how conditions like Peyronie's disease, abdominal fat accumulation, aging, and even medical treatments can create the impression of a smaller penis. Each of these situations requires attention, and in many cases can be treated or alleviated with the right strategies. Now I want to hear from you. Which of these causes caught your attention the most? Were you already aware of the effects that excess abdominal fat can have on the received size of the penis? Share your thoughts in the comments and let us know your experiences. If this content was helpful, hit the like button. Your support is essential to help us reach more people interested in men's health. And if you want to keep learning more about estrosexuality and men's estrosexual health, especially for men over 50, check out the other videos here on the channel.